Yes, we are live now. Welcome to the show. Welcome to the Mithi Goli live talk show on YouTube channel, The Art of Healing Gurukul. Here we have with us Yashika, Dr. Yashika Arora Malhotra. Warm, energetic YouTube live introduction for you. So, a very warm welcome to you and all the audience who's listening to us. It gives me immense pleasure to introduce Dr. Yashika Arora Malhotra, and she's an accomplished researcher, she's an academician, she's one of the promising young leaders in the field of homeopathy. Here we have with us Dr. Yashika. So, Yashika, good evening. So,
Good evening, ma'am. Thank you so much for inviting me on your platform. It feels glad to connect with you. Thank
yes,
you.
yes. And thank you for accepting the invite, and you'll be sharing all your experience about your work and homeopathy. So,
Yeah.
uh, and you are an inspiring figure being a young professional, to all the young homeopaths. That's the reason I called you for this conversation. So the young homeopaths get impressed and they come to know how, they can ascend the ladder of homeopathy, you know. So, yes. So about the your clinical practice, about the research and everything we are going to discuss today. So first question coming to this, I would like to ask you that how do you bridge the gap between this rigorous scientific trial designs, the individualization, the non-linear case taking methods, which are more unique to the classical homeopathy? So there
Yes,
is a
ma'am.
lot of
So thank
debate
you so
happening in this. So I'd like to ask you about the explanation to this, how you manage
yeah.
this.
Yeah, so there is a lot of debate when you talk about this classical homeopathy and when you talk about the clinical trials, the RCTs, the randomized controlled trials, and the research which is going on, which actually requires standardization. There are various names, there are things coming up because there is a lot of debate because of this conflict, and that this is a very contradictory thing. That homeopathy is based on individualization. You have to go for individual remedy as per the patient. And when you talk about RCTs, you talk about research, the field requires standardization. So it is actually appears that these two philosophies are contradictory, but actually the problem if you talk about research and you talk about homeopathy, so the pragmatic randomized trials, I want to mention pragmatic N1 and N1 randomized trials, which are actually required in our field, that helps physicians to individualize prescriptions while maintaining randomization. So one solution to this problem is, and actually the need of the hour, which can stop this conflict and stop this which can be a help to this debate, that pragmatic or N1 trials. And when you talk about clinical research, it also includes practice-based research. So the practice-based research networks and the data collection through standardization from various clinicians, usually treating patients in routine practice, can be a solution to this because we have so many patients coming up, but there are no records. There are no maintaining of the clinical data or which the doctors have. So it actually right now. So there are so many studies which can be conducted, like prospective observational studies can be conducted to actually evaluate the real world effectiveness. And also, I would like to mention a point about patient oriented outcome. So the patient reported outcome measures, if you consider usually, so it is actually beyond the disease course. Whatever we are calculating in the RCTs, whatever we are calculating the scoring, the grading, and everything. So the patient reported outcome can be one of the solutions that we should, as a researcher, as a homeopathic researcher, need to adapt so as to prove that homeopathy is actually an evidence-based medicine, though it is based on individualization. But on the very same track, if you talk about, we cannot force individualized medicine into any experimental model. Okay? Maybe RCTs, maybe controlled trials, maybe that is not that is not that is unsuitable for our experimental model. So for that, we need to find out the solutions, the way out. We also work upon such research papers also. There are many research papers also published, like in 2022 also, CCRH published a paper about these problems, that the flaws which are going on because of ours, which are actually you can say a gap between the RCTs, between the clinical trials, and when you talk about individualization. So yes,
So
there is a solution, the
this is very
pragmatic.
very important. Two important clues you have given from this first question which I asked you. One thing is records are insufficient, and second thing is that we need to find out a solution for the research,
True.
not just evidence
Yeah.
based and just forcing RCT into it, but we need to find a
Yes.
solution. And I think, why can't this be a solution? Finding the research tools for research in homeopathy, that is the important criteria
Yes.
here, because we don't have the right research tools to do research in
Yes, and
homeopathy.
there are trials in different type of research also. Like I have mentioned about pragmatic and one trials, so that will actually be a benefit to homeopathy and research, the homeopathic research, especially when you talk about.
Yes, so that can be one
Thank you for that.
solution. And second solution is because in the conventional research, you'll find so many things which they have introduced to prove their research.
Hmm.
There are unique methods. Like they may test on mice and all. For certain crude things, we can do that. But what about potentization, potentized medicines or diluted medicines, which we usually use it on patients? So how would you prove that? So one thing is clinical evidence, and for that also I have found out that through researching that there are very less trials on patients also, so the data is insufficient. Okay, so when we do the meta-analysis, you'll find very less data to do the meta-analysis, and finally that's where it fails.
That too is much molded and towards the positive outcome, biased sometimes. There
Yes,
is a lot of
biased.
bias in
So
the
this
results.
this this is the very crucial point. We are seeing that it is very effective in so many diseases, even in incurable diseases. We are able to cure the patients, but there is insufficient evidence to prove that through research. So this is very important part of the discussion, and we need to find solutions for it. Now, as you
True.
said that about the records, yes, of course, records. Especially, it starts from the medical colleges and hospitals, and the of OPDs, of course, where the NCH asks 200 patients to be seen every day to the college hospitals and the OPDs. So through that also records can be maintained, and through that also statistics, a survey can be made that what diseases are being cured, or how many patients are going to be
Actually,
relieved.
the reason behind compulsion and mandate of seeing patients and maintaining records is actually the beginning that the commission, the regulatory bodies are trying to the kid, as a kid, when we are just a student, when we are a college student, so we should grasp such things and we should maintain it in our practice. So that is
Yes.
just a beginning and way out ki you can say ki we can start from this,
Correct.
obviously.
So the students should be trained at the student level from the first year itself. They should be research oriented. They should be of that
Yes.
scientific temper that what they are going to learn, they have to do research also on that. So in that way, if they are trained, then once they enter the peripheral OPD or into the hospital, they come with that idea in the brain that we are going to do research on this, and we are going to see whether how these medicines are working on the patients, and we'll keep a record of all these things, so that finally one day we'll be able to submit it in the form of a research paper, and with multiple trials and multiple patient records. So, and this will add up to the National Archives of Research in Homeopathy. So that will contribute to
Plus,
it.
yes, ma'am. Plus, it will change the orientation of the upcoming practitioners. So we'll be
Yes,
more oriented towards the evidence base and the research point of view, which we actually, when you go to clinic and you see a practitioner practicing, he's a clinician and seeing patients giving medicines, seeing patients giving medicines. So this is a routine work. But when you talk about this base, so this will create a different orientation of a budding homeopath, of a upcoming homeopath when he opens up his clinic.
exactly. So now, in your clinical service, can you share
Hmm.
a specific clinical case, where a treatment failure may have forced you to rethink that a remedy can be selected again, or you have to re-evaluate certain doctrine of homeopathy or homeopathic concept. Did you feel a need to do
Hmm.
this anytime?
So, ma'am, when you talk about such things, so there are failures every day we get. Because it is all about a homeopath's perfection and an experience, a practitioner's experience that actually, and plus you can say God's grace. So these are two things that actually matters and show you the right path. So when you are taking a case of the patient of an individual, so there are many things which come up on the first visit, there are many things which come on the second visit. So yes, there are so many examples when you talk about when your first remedy failed, first minimum failed, and when then you had to go for another repertorization, you have to retake the case, or you just missed out the most important observations, and then suddenly on the fourth visit, you get to know that the patient is actually the base of the problem. The cause is something different, and the medicine we are prescribing is totally different. So there are times when it happens. There are so many cases. In fact, upskin ki case mein if you take at first if there is a case of psoriasis coming up to you or vitiligo coming up to you, psoriasis we can take. So you took the case and you have prescribed whatever medicine. Suppose sulfur is was one of the similar medicine that came out to be in repertorization. But at the same time, in 2 3 visits, the patient for the next time he was like the mentals that are presented by sulfur. So they were very different. So he or she was not philosophical. He or she was not filthy, etc. Whatever the sulfur metals come up. So when you talk about fourth or fifth visit, suddenly you get some good strong striking symptoms for the case, and then suddenly you change the medicine, and then the way it is actually you get an experience, and you also get a path towards the recovery of the patient, towards the cure.
So
So
to
there
conclude it,
comes up.
you can say we can say that like every mistake is a learning experience,
Yes,
right?
true,
So even
true.
today, after
So we
25
are
years of
learners for the
practice,
whole life.
we still every case is a mystery.
Yeah.
We can't perfectly
Yes,
say like
absolutely.
yes, I'm going
We
to
learn
cure with
something
this
new.
medicine. Yeah. So every
Yeah.
every patient is a new experience for us, Yes, but
True, ma'am.
regarding the doctrine, regarding the principles of homeopathy, did you ever get a question like where we apply the Herring's law of cure? You know, you see whether your medicine is working according to the Herring's law of cure. You also apply the principles of homeopathy, law of minimum, and all these principles you apply. So, did you get any doubt whether these principles are really applicable? Did you get any time like that? You know, sometimes I wonder. I had to sometime follow up with another medicine after giving the first prescription. Immediately, second prescription I need to give in some cases. So at that times I wonder that about the multiple medicines, as like energy protocols are there or these, so whether they are true, whether they are correct to give it in this way, that also sometimes I think. So did you get any time this kind of question regarding the doctrine, regarding the principles?
So, ma'am, yeah, when you talk about the cardinal principles of homeopathy, yes, the say law of similia, the law or the doctrine of signature, the law of minimum dose, law of single simple remedy. So, potentization, chronic diseases. So, the approach, if you say the philosophy. So during my experience, I won't say this कि it's the philosophy which comes out in doubt to me. ठीक है? Sometimes it happens that the medicine is not acting or the symptom relief is not as per the Herring's law of cure, and it's not following the cure pattern. So there are times which where in such cases happens, we have different observations, like we have kinds 12 observations. So हमें कभी कुछ observation मिलती है, we get some other observation at other time. So, but it is actually not the principle that is into doubt. This is actually our approach. Because, see, if you talk about homeopathy, and when it was discovered, it was more than 200 years ago. It was in 1796 that Master Hahnemann invented this pathy. So to the time period, the location, if you talk about it, it was in Germany. It was different part of the world, and it was actually a very different sort of people living there. The society was different, the lifestyle was different, the diet was very different. And when you talk about after 200 years, the lifestyle today, the modifications we are going through, and the antibiotic therapies and the medicines people are taking like anything before it, and the nutrition at the same time. The nutrition is not to that up to that mark. There are so many adulterations in the food and everything. We don't know, in fact, whatever we are eating. So the lifestyle is totally changed. The modifications, which was 200 years back, it was very different. But
Very different.
when you say about a law, a principle, it is not, it cannot, it is not to be questioned. It is not a question. The question is actually how we are managing the case, how we are seeing the patient the fully, कि उसका हमने सारी चीजें लाइफस्टाइल मॉडिफिकेशन भी देखा, उसका स्ट्रेस लेवल भी देख रहे हैं, उसका सारी चीजें हम ग्रास्प करके we are looking over it, and then we are going deep into the case, and then as per the case we are applying our principle remedy. So when you talk about this, uh, so altogether, uh, the principle says this stays the same. It is only our approach. Plus,
Yes.
I can say that the single simple remedy may during Hahnemann's time was a single dose. Maybe in the case which I am seeing, so in that case, maybe the approach may be different because the patient is having soup every other moment. He's having something medicinal every other moment. He's having something addictive, tea, coffee. There is those no precaution which we in fact we cannot tell patient nowadays कि आप ये precaution लो, आप ये precaution लो, because nobody can take so many precautions. There are so many things going on. So it may be 3 doses, it may be 5 doses, it may be BD, it may be repeated medicine that you have to give. or you have to change the remedy, you have to follow up with the other remedy. The first prescription is this, and the next prescription you have to go through all through another remedy. So at times it happens, but the principle remains the base. It
Yes.
is only that we perceive the patient as per his lifestyle, as per his modification, as per our experience. Okay? As per today's world. So there is a very big change, and this is what actually I feel sometimes we have discussions in previous webinars also with others. So there is a little gap that is actually required. हमें वो खुद डिस्कवर करने की जरूरत है कि आज की जो जनरेशन है, आज का जो स्टेट ऑफ वर्ल्ड है, उसमें होम्योपैथी एक्चुअल में होम्योपैथी को भी जैसे मॉडर्न मेडिसिन ग्रो कर रही है, तो होम्योपैथी किस वे में ग्रो कर रही है. People are doing, CCRH is
Yes.
working upon it,
So
research going.
I'm going to come to that part now.
Yeah.
No, in comparison to the conventional medicine, when we see that
Mhm.
homeopathy is not patentable, okay, so the dilutions are not patentable. So how are you going to bring it into the
What do
scientific
you,
field?
can you please explain what do you mean by patentable?
Patentable means according to the Indian patent law or according to the US patent law,
Like
it
single, this
describes.
remedy is useful in fever, this
Yes,
remedy is useful
because
in fever.
no, no, no. It is patent means the homeopathic dilutions which we are using. Like suppose arsenic, taxomica, 30C, 200C. All these dilutions are not patentable because they are very long years. Since long years we are using it, and it's in the open domain, and it's natural medicine. So it is not it can't be patentable. So people what they are doing is now like energy protocols or those combination medicines. These can be patented depending on the clinical evidence. So people are trying to use multiple homeopathic medicines and different potencies and using it for clinical trials for certain diseases and proving that this medicine is curing that disease or giving a relief to that patient. So, in that way, it can be brought into the scientific domain. So, do you support
See,
this?
yes, see,
Because
this is a very big question.
because this is the only method where you can bring homeopathy into the scientific domain. Otherwise, you
Yeah.
can't.
So first thing, yes, ma'am. So first thing, I would just tell you that patentable when you talk about so medicines are already, these dilutions are already under license, so there is no need of patent of any of the medicines. But at the same time, when you talk about this question, I think you wanted to say this कि जो हमारी medicines है ऐसे specific नहीं है, ऐसे like we have three medicines, antibiotic देनी है, PCM देनी है, ये मॉडर्न मेडिसिन में मेडिसिन प्रोटोकॉल है, ये फॉलो करो, ये इस वाले वायरल को ठीक कर देगा, ये प्रोटोकॉल है, ये इस वायरल को ठीक कर देगा, ये इस डिजीज को ठीक कर देगा, सोरियासिस का पेशेंट है उसको ये प्रोटोकॉल फॉलो करनी है. सो
Yes,
देयर आर
yes,
प्रोटोकॉल्स व्हिच आर बीइंग मेड. So when you talk about homeopathy, we have single symbol remedies, individualized remedies.
yes,
So everybody has every remedy has a different action as per the individual. हो सकता है कि आप एक पेशेंट को आर्सेनिक दे रहे हो, मैं उस पेशेंट को कार्बोवेज दे रही हूँ, दोनों असर कर रही हूँ. सो दोनों पॉलीक्रेज बहुत कहीं ना कहीं उसके किसी ना किसी एक्शन से असर कर रही हूँ. मतलब सेम पेशेंट में दो रेमेडी भी एक्ट कर सकती है कि मैंने उसको कुछ रेमेडी दी वो बढ़िया काम कर गई, आपने दी अपनी फिलोसफी के अकॉर्डिंग आपकी भी रेमेडी एक्ट कर गई. सो देर आर थिंग्स व्हेन यू टॉक अबाउट दिस पेटेंट कि हम उसको इंडिविजुअल एक मेडिसिन को प्रूव नहीं कर पा रहे हैं, एविडेंस नहीं दे पा रहे हैं कि यहाँ ये मेडिसिन इसके लिए प्रोटोकॉल है, तो हम वो चीज नहीं दे पा रहे हैं. तो वहीं पे जहाँ पे होम्योपैथिक फार्मास्यूटिकल्स और यू कैन टॉक अबाउट दीज प्रोटोकॉल्स ऑन एवरीबडी हु इज वर्किंग, or in fact a normal doctor, he is creating a mixture of medicine and giving it on to the patient. अगर अपने क्लिनिक पे he is giving to that patient and he is saying कि yes and he is getting good results and he is retrying it, putting it to a clinical trial, getting it registered under CTRI, and उसके बाद वो सारे registration वगैरह करा के properly he is doing a clinical trial. और अब डॉक्टर और अब प्रोटोकॉल पर्सन जो प्रोटोकॉल बना रहा है बैनर्जी प्रोटोकॉल के थ्रू, या फिर आप एक नॉर्मल होम्योपैथिक पेटेंट ही ले लो. ये लिव टी को प्रूव करने के लिए एसबीएल ने क्लिनिकल ट्रायल किया, मतलब it's just no part that I'm supporting any company, please don't mind, that मैं
Yes,
आपको
yes,
सिर्फ एक
no.
एग्जांपल दे रही हूँ कि एक लिवर टॉनिक को प्रूव करने के लिए एक कंपनी ने क्लिनिकल ट्रायल किया, पेशेंट को दिया हमने, 30 पेशेंट्स को हमने मेडिसिन दी, 30 पेशेंट को हमने वो सिरप नहीं दिया। तो ऑल टुगेदर उस सिरप का एफिकेसी चूज हुआ कि उसमें जो ये 4 मेडिसिन मिली हुई है, दैट इज एक्चुअली वेरी गुड एंड इट इज इफेक्टिव इन लिवर प्रॉब्लम्स, या फिर इट इज इफेक्टिव इन इम्प्रूविंग ग्रेड फैटी लिवर वट एवर। ठीक है, तो उससे प्रूविंग से क्या हुआ, उस मेडिसिन के जो 4-5 कॉम्बिनेशन थे वो एक सिंगल मेडिसिन बन गए। ये बात याद रखना, देयर इज अ वेरी गुड डिबेट अबाउट इट, इनफैक्ट मास्टर हैनेमन हैज ऑल्सो, that I don't remember. I'm not a perfect pharmacist, but yes, I have. Last to last year I revised DD Banerjee. So while going through pharmacopoeias, I went I saw that the pharmacopoeia says that mercury and mercury iodine rubrum. तो mercury और iodine जब उन्होंने दोनों को मिलाया और मेडिसिन को मिलाया, तो जाके उन्होंने देखा कि ये इसमें बहुत अच्छा एक्ट कर रही है। दो एलिमेंट्स को मिलाया उन्होंने, दो मिनरल्स को, और दोनों मिनरल्स को मिला के उन्होंने एक सिंगल रेमेडी बनाई। ठीक है, क्योंकि वो कहीं ना कहीं केमिकल ऐसा था, वो दोनों एक दूसरे के साथ रिएक्ट करे, उन्होंने एक और कंपाउंड बनाया। केमिस्ट, ही वाज अ वेरी गुड केमिस्ट आल्सो, ही वाज अ वेरी गुड, मास्टर हैनमन वाज वेरी, actually he was a gem, so he brought up into those things। तो उन्होंने दो चीज मिलाई ना, उसी के बाद बनाया ना यार,
Banana,
उसी से
exactly.
प्रूविंग हुई
So,
ना।
there should be no conflict between the principles and this
The
formulations of
patent
medicine.
medicine. Yes.
Medicine.
No,
So, the
no, I
primary
don't agree,
aim.
because if you're getting a license of a medicine, whatever patent he company is giving, there's no thing कि ऐसा कि पैसा खिलाओ और सब कुछ हो जाता है, पैसे खिलाओ ऐसा
हाँ,
कुछ होता
हाँ,
है, ऐसा
हाँ,
कुछ नहीं होता। There are clinical company
right.
go on. I've worked with so many pharmaceuticals in my in my career. So there are people, there are companies जो कि trial कर रही हैं, they are performing trials and they are giving those trial results। वो CTRI के अंडर जाके खुद से रजिस्ट्रेशन करा के सारी चीजें देखते हैं, फिर उसको एक पेटेंट को मिलाकर वो पेटेंट दे रहे हैं। एंड अगर वो एक पेटेंट को हम सिंगल मेडिसिन मान के उसको पेशेंट को दे रहे हैं, उसमें 4 मेडिसिन का कॉम्बिनेशन हो, तो यार एक मतलब देयर इज अ फिलोसफी विच आई फील कि मैं ये नहीं कह रही कि तुम पेटेंट दो, मैं ये भी नहीं कह रही कि तुम सिंगल रेमेडी को मत फॉलो करो, मैं ये भी नहीं कह रही कुछ, बट अगर तुम उसकी एंटीबायोटिक को कम कर सकते हो ना, एक कफ सिरप देकर
There's
अपने,
nothing more,
आप
there is nothing more beautiful
जस्टिशिया,
than that.
यस, जस्टिशिया मदर
Because
टिंचर दे के, अगर आप अपनी अगर आप अपनी मेडिसिन के साथ आपने रियोमेक्स दी, स्पॉन्जिया दिया, जो भी दिया, ड्रॉसरा दिया, उसके साथ आप एक जस्टिशिया मदर टिंचर लगा रहे हो ना साथ में, और पेशेंट को एलोपैथी नहीं लेनी पड़ रही, उसको एएमआर रेजिस्टेंट नहीं होना पड़ रहा, मतलब दैट इज एंटीबायोटिक रेजिस्टेंस, ही इज
yes,
नॉट प्रोनिंग टूवर्ड्स। सो उसके उससे ज्यादा और बेनिफिशियल व्हाट यू विल डू टू द पेशेंट। अगर
yes,
रिलीफ आ रहा है सिंगल रेमेडी से, ग्रेट, यू आर अ परफेक्ट डॉक्टर, यू हैव एविडेंसेस, यू हैव वेरी गुड प्रैक्टिस, यू हैव वेरी गुड एक्सपीरियंस, और आपकी सिंगल रेमेडी आपके हाथ में इतनी शफा है कि वो सिंगल रेमेडी बहुत अच्छा काम कर रही है, तो वेल एंड गुड, गो फॉर इट। बट एट टाइम्स देर आर स्टेज जहाँ पे पेशेंट को रिलीफ नहीं आ रहा है, पेशेंट को प्रॉब्लम हो रही है, पेशेंट एलोपैथिक डॉक्टर के पास भाग रहा है। आई हैव सो मेनी सीकेडी पेशेंट्स। The last webinar I took was of CKD case only, which I discussed in the
especially
webinar.
when we find immunocompromised patients, terminally ill patients, okay, those who have
तो
already
होम्योपैथी
got
अगर पैलिएटिव,
multiple layers,
यस,
in those
यस,
cases we find
मल्टी
extremely
ऑर्गन
difficult
इन्वॉल्वमेंट,
to give single remedy. At that time there
यस
comes a
मैम।
question whether we can apply the complex
अगर उनको साथ
medicines.
में बीपी के लिए रोल्पिया देनी पड़ रही है, अगर बीपी के लिए आप साथ में उस शुगर के लिए आप साथ में उसको साइजीजियम दे रहे हो या सिप्लांड्रा दे रहे हो, तो उसकी जो वो एलोपैथिक वाली डोज है वो उसकी आप कम करें। अगर उसको उसके बाद इंसुलिन लेनी पड़े कि आप उसको कंट्रोल तो कर रहे हो सीकेडी में, ठीक है, आपने उसका क्रेटिनिन कम करने के लिए मैंने उसको क्रेटिनिन 200 दे दी, उसका क्रेटिनिन तो कम जा रहा है, बट उसकी शुगर नहीं कम जा रही, उसकी बीपी नहीं कम जा रहा, जो कि एक्चुअल में उसका मल्टी ऑर्गन इन्वॉल्वमेंट है और मल्टी ऑर्गन उसको परेशान कर रहा है. सो एट द सेम टाइम व्हेन यू टॉक अबाउट दिस थिंग, तो आपको अगर पेशेंट को एल सीरम 7x साथ में दे रहे हो, या फिर आप साथ में रोल्फिया साथ में चला रहे हो, या फिर आप साइजीजन दे रहे हो, और उसकी पेशेंट की कंडीशन ओवरऑल बेटर हो रही है, और उसको एलोपैथ के पास नहीं जाना पड़ा, जो कि जैसे ही वो जाएगा उसको डायलिसिस पे डाल देगा. अगर क्रेटेनिन 4-5 से ऊपर हुआ, वो सीधा डायलिसिस पे डाल देगा,
So,
6
so,
पे
so,
या 8 पे. दे डोंट हैव एनी
Dr.
अदर.
Yashika, you just gave a very valuable contribution here. This will solve the doubt of many young, fresh homeopaths who are in confusion whether to practice the classical homeopathy, where to practice this complex homeopathy. They're
Classical
just very
homeopathy is all
confused.
about following our principles, ma'am. It is never about using patents or
but
single
but
remedy. It
but
is never about.
people are almost confused in this. They don't think along the lines
Because there
of
is
a
so much
researcher,
difference of.
of a researcher you know
शंकरन सर की फिलोसफी लगाती हूँ. शंकरन सर की 8 बॉक्स मेथड से नहीं हो रहा, तो मैं कई बार बैनर्जी सर का प्रोटोकॉल यूज करूंगी. मैं कई बार अपना खुद का ही कुछ सर्च करके, या कभी मैंने सैकल को फॉलो कर लिया, कभी किसी को जीएनएम थ्योरी निकाली. तो देर आर सो मेनी थिंग्स कि किसी में भी अगर आपको कुछ नहीं मिल रहा, तो देर आर अनदर स्टेप.
so
सो
it's it's very
व्हाट आई फील इज कि मुझे.
important it's very important for a physician, homeopathic physician, to follow all the multiple methods of the pioneers, use their own
Yes,
mind common sense to treat
yes,
the
as
patient.
per their experience.
There is a treasure of homeopathic medicines provided by Dr. Hahnemann to us. Even the new medicines are there which are being poured. So there's a big treasure. Just you have to explore, put in your efforts, and there is nothing more beautiful than homeopathy to treat
True,
patients. So
true,
this
ma'am.
is a lesson for all the students who are watching us and all those homeopaths who say homeopathy doesn't work. There are still homeopaths who say that homeopathy is not working and I wander off to get certificate courses to practice homeopathy, so allopathy. So here is where they can understand that there are some efforts still they have to put up to treat patients using homeopathy. Okay, so that was wonderful. Thank you, Dr. Yashika. So
Thank you.
next is about research methodology and evidence. So, what do you see as the biggest methodological flaw in the current homeopathic clinical trials, and how do you think young researchers can fix it? Because there is a lot to be done by the young researchers. The coming
Hmm.
upcoming homeopaths, have a responsibility, you can say, or accountability to contribute to the homeopathic research. The homeopathic hospitals also have the all the colleges, homeopathic college people who are listening, they should also think on these lines, that how much contribution they should put up in the research. As we are doing the Ghar Ghar homeopathy project, and I feel homeopathy works very fast because I've seen working it very fast in very few doses within 5 minutes, 10 minutes I've seen it working. So I feel
मैम
homeopathy.
पीसीएम से इट इज अ बेटर दे पीसीएम से बेटर रिजल्ट देती है हमारी मेडिसिन.
Exactly,
पीसीएम 40 मिनट्स में
PCM
एक्ट करती है. 40 मिनट्स में बुखार उतारेगी, हमारी मेडिसिन और जल्दी उतार
Yes,
देती है. टेन
exactly.
फिफ्टीन
I've
मिनट्स
seen
यस.
Delcamara removing the vesicles which are caused by the rainwater. Patients have come to me, I've given few doses of Delcamara, and within you see that is gone. The skin
ट्रू.
eruptions have gone.
एब्सोल्युटली.
And sulfur has worked wonders in so many of patients, so thousands of patients. So in this way, you have
ट्रू.
Artica urines to which can be used for the the
आर्टिकल.
itches caused by the insects, or you can say the hay. People usually in the rural areas where I work, these children who play in the hay stacks, they get all over the eruptions and they come with itching and all, and few doses of Artica within 5-10 minutes all the eruptions are gone, the itching is gone. So you see how it wonderfully works. Arnica works so wonderfully. Pain कितना जल्दी relief हो जाता है arnica से. So all this which we have experienced, we have seen. So I see that homeopathy as a wonderful emergency medicine. And I want colleges and hospitals to participate in this research, regarding the emergency medicines. We have hospitals in the colleges, we have emergency wards, we have emergency department. How many homeopathic medicines are being given in the emergency department? Is there a record? Is there an emergency crash tray? Is Has the NH our National Homeopathic Council recommended emergency tray with the homeopathic medicines which can be given in certain cases? So all these efforts have to be put up where we can prove that homeopathy can also work very fast
Yes, ma'am.
in acute
And
medicine.
and I would just want to mention that the councils, the research council, the commission, everybody is working so hard about it to bring out into action. But yes, it is there is a gap between the researchers, between the ministry, between the practitioners. If you talk about the clinical hub, जो कि एक्चुअल में गवर्नमेंट को द एक्चुअल हब ऑफ होम्योपैथी प्रैक्टिशनर्स जो क्लिनिकल प्रैक्टिशनर्स और फार्मास्यूटिकल्स हैं वो ही आज की डेट में टर्नओवर दे रहे हैं सो देयर इज अ गैप बिटवीन दीज बोथ तो एक गैप को क्लियर करने के लिए वी शुड वर्क अपॉन ऑल्सो ये भी
That's
मैं
very
ऐड करना चाहूंगी
That's very important to bridge the gap between the practitioners, between the pharmaceuticals and the NCH, where all together they come together and formulate these policies to um,
बिकॉज रिसर्च हो रही है बट वो हम तक नहीं पहुंच रही है कहीं ना कहीं जो प्रैक्टिशनर्स है उनको नहीं पता चल रहा कि क्या मोनोग्राफ पब्लिश हो रहा है किस चीज पे किस ड्रग को उन्होंने प्रूव किया है फिर से तो वो सारी चीजें कहीं ना कहीं प्रैक्टिशनर्स तक पहुंच नहीं रही है और वो उस चीज को उनका ओरिएंटेशन भी नहीं है तो आई फील कि बडिंग होम्योपैथ्स का थोड़ी ओरिएंटेशन उस तरफ होनी चाहिए
उस तरफ होनी चाहिए और
नॉट
ये
ओनली द
कोई ये
रिसर्चर और हु
मैंने
इज
मैंने
वर्किंग इन
कई
द
मैंने
काउंसिल
कई प्रैक्टिशनर्स से बात की। बहुत सारे प्रैक्टिशनर्स के अपने खुद के प्रोफेशनल सीक्रेट्स है, दे डोंट रिवील इट आल्सो। So this thing should not happen. There is no professional secrets. This is not ethics. It is not ethical. So treatment methods and all should be open and they should be researched properly and there should be a bridging of this gap
और
between
मैम
the National Council
this gap they're
practitioners.
trying the
Yes.
colleges hospitals are trying the bodies are trying to cope up with this but yes as per the society it is
So once the idea is put up in the universe, my concept is once we put this idea into the universe, somehow it works, and that is the reason why we are talking on this topic. You know, so once we put up this idea that there should be a bridging of this gap, ultimatum is that it will start working and one day you will see that all these which we are talking will come into existence and that's where homeopathy will
yes
grow as a scientific medicine, you know. So
sure yeah
uh, the next question is, what is the hardest part about translating the subtle homeopathic clinical observations into objective, peer-reviewed language, which can come into the mainstream, scientific journals, which will accept it. Like like I said about the meta-analysis, that's where we are failing. So
there comes bias there comes everything which comes up where जब आप एक केस को you are converting into a peer reviewed publication for a peer reviewed publication so um, you have to be specific with the whatever research you have done कितना sample size था कितना क्या था the documentation properly the follow up and the outcome measures सारी चीजें you have to note down उस time पे and when you're converting into peer reviewed publication so you have to take care of the guidelines the care guidelines the all the guidelines as per the case अगर आपका case report है तो आपको care guidelines follow करनी है आपका if you want to go for concert guidelines है stroke guidelines है everything is available on equatornetwork.org so it gives you ICMGA websites, ठीक है, it is given on equatornetwork.org, तो it makes it very very easy कि आपको उसको कन्वर्ट करने के लिए इजी रहता है, बट देर आर सो मेनी चैलेंजेस जो आते हैं कहीं ना कहीं to follow the you have to follow about the blindness of the patient and everything, आपको सारी लॉस वगैरह सब ध्यान रखना पड़ता है, पेशेंट कंसेंट का ध्यान रखना पड़ता है, एंड वन थिंग इज लाइक कि कई बार वी फील कि the doctor or public the author has made biased towards the positive outcome, to give the positive outcome in the case or to give the positive outcome in the research. So there, this sample sizes issue, the biased issue, and the guidelines which actually is not up, मतलब which actually अगर आप नॉर्मली प्रैक्टिशनर के पास जाओगे तो जो क्लिनिशियन है वो अपनी प्रैक्टिस में इतना बिजी है कि उसको पता ही नहीं कॉन्सर्ट क्या है, स्ट्रोक क्या है, स्ट्रोक नहीं पता किस गाइडलाइन के थ्रू क्या करना है, तो कहीं ना कहीं जो होम केस गाइडलाइंस हैं तो एवरी एवरीथिंग इज अवेलेबल ऑन वेबसाइट, बट यस व्हेन यू आर राइटिंग अपॉन इट, सो बहुत सारी चीजें
So
हमारे लिए प्रॉब्लम है व्हेन यू कन्वर्टिंग अ केस.
what you said is very right. At this point of time, every student should be thought about research also here in homeopathy, especially because unless that is done,
या
then there is no point, going forward. You know, रिव्यू करने के लिए तो भी रिसर्च ओरिएंटेड होना चाहिए ना. अगर कोई किसी ने रिसर्च का पेपर डाल दिया
यस
है.
मैम, और आपको पहले से यू शुड, हाँ, आपको पता होना चाहिए कि आपकी जो बेसलाइन फाइंडिंग्स क्या हैं, आपके आगे ऑब्जेक्टिव मेजरमेंट्स आप क्या रखोगे, कौन सी टेस्ट लगाओगे, कौन सा टूल अप्लाई करोगे, कौन सा स्केल यूज करोगे असेसमेंट के लिए. तो वो सब चीजें बहुत मैटर करती है जब आप एक क्लिनिकल केस को पब्लिश कराना चाह रहे हो. तो फॉलो अप, आउटकम असेसमेंट एंड एवरीथिंग इज डिपेंडेंट, मुनार क्राइटेरिया, आपको बहुत सारी चीजें बहुत मैटर करती है ये सब.
मैटर करती है और इस सब की जानकारी स्टूडेंट्स को भी होनी चाहिए और यंग डॉक्टर्स को भी होनी
बिल्कुल
चाहिए,
होनी
ताकि
चाहिए,
ताकि अगर
बिल्कुल
कोई
होनी
रिसर्च
चाहिए.
पेपर डाला गया है इंटरनेट आर्चिव्स पे जाकर हम सर्च करेंगे तो बहुत इंडियन आर्चिव्स में बहुत कम रिसर्च पेपर्स आपको दिखेंगे और जब इंटरनेशनल आर्चिव्स पे जाएंगे तो और भी दिखेंगे. बट देन द कंक्लूशंस एंड देन द रिव्यूज आर वेरी कन्फ्लिक्टिंग, तो इस पर हम मात खा जाते हैं कि बाबा होम्योपैथी काम करता है कि नहीं. हाँ, अगर आप फिर भी आप चैट चैट जीपीटी पे जाओ और कहीं भी जाओ आप होम्योपैथी के बारे में सर्च करेंगे तो वहाँ पर आएगा दिस रिसर्च इज इनसफिशिएंट एंड द एफिकेसी मैटर्स. सो ये आना नहीं चाहिए. सो ये जो डिजिटल इम्प्रिंट चैट जीपीटी ने भी कैच कर लिया है.
मैम सबसे बड़ी बात तो हम लोग अभी तक विकिपीडिया से यही नहीं हटा पाए
नहीं
कि
हटा पाए.
होम्योपैथी इज अ
नहीं
सूडोसाइंस.
हटा पाए.
अभी भी
अब
उस पे,
अब विकिपीडिया को कोई मानता नहीं है लेकिन फिर भी चार चैट जीपीटी ने भी डेटा कलेक्ट करके यही पॉइंट आ रहा है कि इट इज़ नॉट एफिकेसी, इट इज़ नॉट नो, यू कांट बिलीव ऑन दिस. तो
मैम फॉर
एक तो
दैट बेसिक रिसर्च इज वेरी इंपॉर्टेंट.
सो रिसर्च में मेटा एनालिसिस तो इम्पोर्टेंट है ही है. सो ह्यूज क्वांटिटी ऑफ रिसर्च इज नेसेसरी.
मैम
डिजिटली
लेकिन उसके लिए
डिजिटली
ह्यूज क्वांटिटी ऑफ रिसर्च होनी चाहिए.
रिव्यूज भी
हाँ,
होने चाहिए,
डिजिटली होनी
पेयर
चाहिए कि
रिव्यू.
मेटा एनालिसिस बनाया जा सके.
एग्जैक्टली. सो
यस मैम.
इसका आर्चीव्स जो है
यस मैम.
लैक्स एंड लैक्स ऑफ रिसर्च डिजिटली होने चाहिए आर्चीव्स में, ताकि चैट जीपीटी इसको कैच कर सके. उसके पेयर रिव्यूज भी ऐसे होने चाहिए. इतने क्वालिटी हाई क्वालिटी का रिसर्च होना चाहिए ताकि वो रिव्यूज भी पॉजिटिवली इसको
मैम फॉर
इम्प्लीमेंट हो
दिस
जाए.
बेसिक रिसर्च इज एक्चुअली शुड बी टेकन केयर ऑफ. इसका एक आंसर मैं आपको यही देना चाहूंगी. इसका एक सोल्यूशन ये है कि हम फंडामेंटल और बेसिक रिसर्च पे फोकस किए क्या करें, जो कि सीसीआरएच भी कर रहा है एट द सेम टाइम. फंडामेंटल और बेसिक रिसर्च बहुत इंपॉर्टेंट है क्योंकि एक्चुअल में जो नानो पार्टिकल्स का एक्शन है, जो फिजिको केमिकल कैरेक्टरिस्टिक्स हैं, जो वॉल्यूमेट्रिक मेजरमेंट्स हैं, जो हम लोग विच टेम और और ऑन इन विवो स्टडीज जो हम कर रहे हैं, इन विट्रो स्टडीज है, तो उनका जो रिजल्ट है ना वो जितना ज्यादा रिसर्च होगी और उतने ज्यादा पब्लिकेशंस होंगे उन चीज पे, जितना ज्यादा उसका रिसर्च देगा उस चीज को हमें क्लिनिकली उसको कन्वर्ट करना, ट्रांसलेशनल वैल्यू उतनी ज्यादा बढ़ जाएगी. सो इट इज
सो ये
एक्चुअली द
सिर्फ सिर्फ
ट्रांसलेशनल वैल्यू जो कि हमें.
ये सिर्फ सीसीएच के लेवल पे नहीं हो पाएगा, है ना. ओनली
उसके
सम
लिए प्रैक्टिशनर्स
पार्ट
को
इसके
करना
लिए
पड़ेगा.
प्रैक्टिशनर्स को करना पड़ेगा. इसके लिए
प्रैक्टिशनर्स,
कॉलेज
कॉलेजेस,
कॉलेज के
हॉस्पिटल्स.
स्टूडेंट्स को, अगर हर एक स्टूडेंट को एक रिसर्च पेपर भी दे दिया तो फिर कितना आर्चिव्स तैयार हो जाएंगे इंटरनेट पे, अपने पोर्टल्स पे, जो रिसर्च पोर्टल्स पे बहुत सारे आर्चिव्स तैयार हो जाएंगे. सो विद इन अ ईयर इफ यू कीप अ टारगेट ऑफ सो मेनी रिसर्च आर्टिकल्स एंड रिसर्च पेपर्स एंड क्लिनिकल ट्रायल्स, so each and every college can contribute to this work, and there will be a good quality, of
Yes,
research, and I think that can be
yes.
one solution.
I hope this reaches to the colleges, the hospitals, and everywhere. And in fact, CCRH
That's
also,
the
I would
intention. That's the
say,
intention.
it should reach because there is a gap
That's a gap.
which is to be covered.
Yes.
Though
So
they are trying their level best, but yes, there is still a gap जो कि हमारी होम्योपैथी को और बढ़ने से रोक रहा है.
yes. So
Because
absolutely. So
आगे आने वाले टाइम में it is all about integrative management. It
integrative
will never be
management.
about conventional medicine.
No.
It will
So
never
for
be about.
for
Today is
becoming
it
an
today.
integrated medicine, we have a great challenge, and for that challenge, we have to be prepared well. Without knowledge, you will not be able to prepare well,
Yes.
and will have to have the knowledge right from the student level, right from the college level. So it's a basic responsibility of every college to teach their students in a research-oriented way, and uh,
They are doing,
contribute.
मैम. जो CCRH ने एक प्रोग्राम स्टार्ट कर रखा है STSH का फॉर UG स्टूडेंट्स एंड MD डेजर्टेशन का फॉर PG स्टूडेंट्स. उसके थ्रू भी बहुत सारे आजकल ऐसे पेपर्स आ गए हैं जो इन विट्रो इन विवो स्टडीज हो रही है कॉलेजेस में भी. दे आर
I know
मोल्डिंग
about
द
it.
स्टूडेंट्स. यस,
So many students are
यस,
very enthusiastic to learn about all these things,
यस.
but they are not getting that basic,
Prop
knowledge,
basic
guidance.
the path, you can say, the guidance.
Yes,
Yes,
yes. So where is that
yes.
fault? I know very well, but they have to manage at the institutional level. So I will not raise
Yes.
that topic. So, yeah, next is how do you respond with when a peer reviewer, suppose a reviewer, you put up a a research paper, and then a peer reviewer from a conventional medicine. Most of the peer reviews are from the conventional medicine only. When you search in the international research papers, you'll see the peer reviews are always from the conventional medical journals. What the question, the biological plausibility of the high dilutions. So, suppose if you are publishing a research paper and a conventional person, conventional doctor or medical journal, they will put up a question. So, how would you respond to that?
See, ma'am, when you talk about any science or anything, so somebody else who's telling our like it is about life also. कोई हमें हमारी गलती बता रहा है तो वो हमारा वेल विशर है. हमें ये
Well,
सिखाया जाता है
exactly,
हमेशा से.
exactly.
तो अगर answer it very well. और whatever question
I think we lost Dr. Yashika is offline or what? Yes. Okay. So Dr. Yashika is back. Yes. So we were about the critics or about the peer reviews by conventional medical system. Yes. Your voice is not clear. I can't hear you. Not audible. You're not audible. Yes, the conversation was very on with the high, and we lost Dr. Yashika. Are you able to hear me? No, can't hear you. Hello? You can hear me. Okay, but I'm not able to hear you. I think audience is able to hear. Dr. Yashika, can you rejoin? Can you rejoin using the same link? Hello? Yes, I can hear your daughter's voice.
Hello?
I can. Yes, yes. Now you're audible. Oh, I think there is a issue with her internet. Yes, Dr. Yashika is back.
Yeah, I'm sorry. There was
So
some
I think
network
there may
issue.
be some network issue.
Yeah.
Yes.
Yes,
Yeah.
ma'am.
So we were talking
Sorry.
about peer reviews.
Yes, ma'am. So I just said ki, we should welcome such critical comments because they are actually giving us a way out to give the answer back to the to the other systems of medicine. That yes, how we can through our fundamental and basic research, how those translational value to clinical research can prove the biological plausibility and the comments we get usually in peer reviewed from peer-reviewed conventional medicine people. So it is an opportunity you should feel, and we should welcome such critical comments.
Yes, it is opportunity to improve ourselves. But what I see in the researchers is that it is not being followed up. When there are some critical comments, they have to be followed up. The better research had to be done on the same thing again and again. The thing has to be peer reviewed. And here, not only the peer reviews should be from the conventional system, it should be from the peer homeopaths also. And that is not happening. I have studied so many of the international research papers in homeopathy. Everywhere you will find the peer reviews are from the conventional system, but the peer reviews are not from our fellow homeopaths who are pioneers and who are having a lot of advantage in their a lot of name and fame and everything, but these people should also come forward and provide the peer reviews to their fellow homeopaths who are doing the research. Okay, so that
True.
unity should be there and that kind of study should be there. So, next question would be, how would you choose between conducting a basic observational case series versus a randomized control RCTs, So how how do you
मतलब
choose between,
मैम both
suppose
are different.
there is a limited institutional resources. What I find is
Hmm.
that same thing. I don't know how it works in the CCRH and all, but limited institutional resources, and you
Is
have to.
limited. So we usually, when you talk about MD students, also we or as PhD students also, or anybody who is doing research in colleges. So there comes a time limit. There comes a limit of patience, and you have some. मतलब there are institutional मतलब देर आर सम बैकलॉग्स कि हम लोग उस चीज को कवर नहीं कर सकते बैकलॉग भी नहीं कहेंगे आई जस्ट फील दैट constraints I the right constraints is the right word so institutional constraints जो है वो कहीं ना कहीं लिमिट कर देते हैं जैसे आप बोलोगे that that a student will go for prospective observation study that would be easy basic observational study that would be easy for him in the viva or that would be easy for him to research to prove results so wahin pe agar he goes for RCT he has to go for scales he has to go for test analysis statistical analysis data management and proving the efficacy of the intervention used so, as per the disease, as per the scale, international scale guidelines and everything.
तो
तो कहीं
इसमें
ना कहीं
इसमें रिसोर्सेस भी चाहिए, इसमें टाइम भी चाहिए, और इसमें लिमिटेड टाइम
फंडिंग भी
होता
चाहिए
है और फास्ट
और
फंडिंग भी चाहिए, इसकी वजह से मैन्युअल पावर भी चाहिए, क्योंकि टाइपिंग करना उसके लिए डिफरेंट केमिकल्स यूज्ड एंड
उसके बाद
डिफरेंट ऑल दिस
स्टैटिस्टिशियन भी
थिंग्स,
चाहिए
स्टैटिस्टिशियंस चाहिए, इस सब के लिए फंडिंग भी चाहिए। ओके, सो बेसिकली इसलिए स्टूडेंट्स क्या करते हैं, ज़्यादा करके कॉम्पेरेटिव कर लेते हैं,
कंपैरेटिव कर
दिस
लेते हैं
इज,
ऑब्जर्वेशनल
हाँ,
कर लेते हैं सिंगल
ऑब्जर्वेशनल
रेमेडी
कर
यूज
लेते
कर
हैं,
लेते हैं
ऑब्जर्वेशनल
वेलेडोनाइन
तो
टॉन्सिलाइटिस
हाँ ठीक है, हमारा जो रिसर्च का बैंक भरने के लिए वो ठीक है, लेकिन कितना बैंक भरोगे और उसका फिर मेटा एनालिसिस करेंगे तो क्या आएगा रिजल्ट, है ना, तो
मैम वो पब्लिश
इसीलिए
भी नहीं होते हैं डू
पब्लिश।
यू इट्स ट्रू दैट इतने स्टूडेंट एमडी कर रहे हैं अगर 150 स्टूडेंट्स आर डूइंग एमडी ईयर एवरी ईयर सो हाउ मेनी रिसर्चेस आर गेटिंग पब्लिश्ड if 150 students are passing out every year तो कितनी रिसर्च पब्लिश हो रही है अगर वो
सो
रिसर्च
इसके लिए
पब्लिश हो रही होती
क्राइटेरिया देना चाहिए कॉलेजेस को, और क्राइटेरिया देने के बाद इसी पर रिसर्च करो, टॉपिक शुड बी प्रोवाइडेड बाय
मैम
द,
हाँ मैम दिया हुआ ये क्राइटेरिया है ये कंपल्जन है कि एमडी में आपको इतने पब्लिकेशन करने हैं यूजी में आपको इतने पब्लिकेशन करने हैं पीएचडी में इतने पब्लिकेशन करने हैं बट कहीं ना कहीं वो भी एक फॉर्मेलिटी ही चल रही है
फॉर्मेलिटी चल रही है, सुपरफिशियल
यस
चल रहा है, और सो दैट इज वेयर वी हैव
सो
टू
बेसिक
लुक
वो
इन।
दे फाइंड आउट मतलब पीएचडी में भी हम वी ट्राई टू फाइंड आउट एलर्जिक राइनाइटिस के केस ले लेते हैं ये इजी रहेगा यूआरआई इजी रहेगा या फिर गेस्ट्राइटिस इजी रहेगा सो मतलब जो हमें इजीली मिल पाए सारी चीजें एंड वी सी इट
नहीं,
इन
वो
एवरी डे
उसके लिए रिसोर्सेस भी तो चाहिए ना, अगर दे आर सीरियसली, सब सपोज वन ऑफ द स्टूडेंट इज वेरी सीरियसली वांट टू डू सम रिसर्च, क्लिनिकल रिसर्च, बट ही शुड बी प्रोवाइडेड दैट काइंड ऑफ रिसोर्सेस, राइट,
यस
ही
मैम
हैज टू
फिर
बी गेट।
उसको पेशेंट चाहिए होंगे चाहे एलोपैथिक हॉस्पिटल में या कहीं भी वो उसको एमओयू या थोड़ा बहुत सपोर्ट उसको चाहिए होगा कि वो अपनी इंटरवेंशन दे सके उसके रिजल्ट्स पेशेंट से पूछ सके तो वो सारी चीजों की लिमिटेशन की वजह से कहीं ना
लिमिटेशंस
कहीं वी
होना
आर
चाहिए, और उस कॉलेज की तरफ से या उस इंस्टीट्यूशन की तरफ से उसको encouragement मिलना चाहिए। If somebody
आई
is
स्टिल
doing
वांट टू
something out of
यस
box, I have seen students who want to do
यस
something
मैम
out of box and they are getting suppressed by the institutions. As a being a
बट
head
मैम
of
एट
an
द
institution,
सेम
I
टाइम
know
इंस्टीट्यूशंस भी बहुत मेहनत कर रहे हैं कुछ कोशिश कर रहे हैं
कुछ
मैं
अच्छे
ये नहीं कहूंगी कि
इंस्टीट्यूशंस भी
नहीं
है और कुछ इंस्टीट्यूशंस भी है जो सप्रेस करते हैं, तो आई नो
हाँ सो देयर
द
इज
फैक्ट
एवरीथिंग कि
देयर
नेगेटिव
इज नो
पॉजिटिव
डाउट, yeah, both things are there, but I know basically we have more and more of private colleges rather than So we, especially in Maharashtra, I would say. So people have to learn something. If you want your homeopathy to advance, if you want the integrated medicine someday, you will have to do all these things. So take it patriotically, take it emotionally. So that's how it works.
True,
Yeah.
ma'am.
A- And how do you choose between conducting a yeah we discussed right now. So coming to our last few questions with research point of view, uh, in what ways you would utilize standard guidelines like home case or care while documentation while doing the documentation of your day to day
Hmm.
clinical outcomes? Is this practiced usually in the hospitals?
How does these guidelines help clinical practitioners, you are saying?
Yes, yes. How they help
Yes.
and how whether it is used or not. Actually, how there will
Yes,
be
ma'am.
standard
They really
guidelines.
help out. They really help out. But yes, I already said that there is a lack. जो पेशेंट जो प्रैक्टिशनर प्रैक्टिस कर रहा है क्लिनिशियन बैठा है ना क्लिनिक पे ही इज नॉट गोइंग टू इक्वेटर नेटवर्क आधों को तो वेबसाइट ही नहीं पता होती यार आधों को ये नहीं पता तो कौन सी गाइडलाइंस
नहीं,
फॉलो करनी है
नहीं पता होती है
कौन सी
बिल्कुल।
गाइडलाइन तो कहीं ना कहीं वो रीच ही नहीं हो रहा है देयर इज समथिंग विच इज मिसिंग जो कि एक जल्दी करना जरूरी है मतलब दिस इज द नीड ऑफ द आवर आई वुड से
Yes. So clinicians should also be educated regarding these things. People, yes.
सॉरी मैम
Yeah. So thank you for giving so much of time. Only few questions are limited. I know you came late from your work, and yes, of course, you may be feeling sleepy too. So yeah. So coming to what is the hardest part about translating the subtle homeopathic clinical observations into objective peer-reviewed language that mainstream scientific journals will accept? Because in the homeopathic presentations, in the
मैम जी
homeopathic,
ऑलरेडी डिस्कस्ड आई थिंक ये दिस इज अ सिमिलर क्वेश्चन वी डिस्कस जब
yes,
हमने
yes,
ये डिस्कस किया था
similar
कि
question. यानी
हाउ
इसमें
कैन
हार्ड पार्ट
हेलो
क्या है, यानी हार्डेस्ट पार्ट क्या है, यानी इसमें करने के लिए, ट्रांसलेट करने के लिए प्रॉपर, बेसिकली ये क्वेश्चन ज़्यादा करके स्टूडेंट्स में ही आता है।
मैम कहीं ना कहीं वी हैव टू ये जो हमारा बायस्ड है ना द बायसनेस आई फील कि ये ट्रांसलेशनल वैल्यू बनाने ट्रांसलेशनल करने में थोड़ा सा कहीं ना कहीं वी लैग बिहाइंड व्हाट I feel is कि translate करने में from the clinic from the case to a peer reviewed publication कहीं ना कहीं हम biased we become biased we try to mold the case so this is the biggest challenge which is coming up I feel
Okay.
my daughter is making so much noise
Yes,
sorry
yes, yes, she want to spend time with you. Yeah, finally we come to the last question.
hello is long yeah.
So how can academic institutions better train the young homeopath students to think like critical scientists without losing our traditional art of homeopathy and prescription?
So, ma'am,
What is
this
your
is
idea?
again a very this is a very vast question, and yes, institutions and every institution of related to homeopathy, which is working, they are trying to shape the children, shape the budding homeopaths into research orientation. If you say about colleges, they have been made mandatory to attend electives. Such electives are based on GCP's. This is good clinical practice guidelines. They have to do this compulsory. They have other electives also wherein they get to know about the system of medicine. So from the UG level only, they are being given exposure about the research, about the good clinical practice, and the regulatory body. is doing great about it. They are actually
Yes,
working
absolutely.
upon such norms, such amendments that the students are molded. बहुत सारी ऐसी चीजें हैं जो undergoing भी है, ongoing भी है. They are under process also. That is actually they are trying best ki from the very bud, jab there is a bud
Yes,
of a
absolutely,
homeopathic budding
absolutely.
homeopathic.
I can see,
So
absolutely.
they can they become a flower. They when they flourish, so they flourish in a very right way. So it is on the way, but yes, everything takes time, and yes, अगर हमारी अप्रोच स्टूडेंट्स की अप्रोच और हमारी प्रैक्टिशनर्स की अप्रोच भी थोड़ी सी मोल्ड होगी, और इधर से भी सपोर्ट जो रेगुलेटरी बॉडीज है, जो रिसर्च बॉडीज है, उधर से भी थोड़ा सा इंटरैक्ट.
इंटरेक्शन होना बहुत इम्पोर्टेंट. यस, yes, yes. Thank you for that. Yes, we see that the regulatory
ओके.
bodies are doing a great work here in uplifting homeopathy. Last question is, how would you see homeopathy coming into mainstream as an integrative system of medicine within coming 5 years? Where do you see homeopathy? Yes, yes, Dr.
हेलो.
Ashika.
आई थॉट नेटवर्क इश्यूज.
Yes, yes, yes. So my last question is that where would you see homeopathy, in as a integrative system of medicine coming into the mainstream, where you see that homeopathic, even the hospitals, private hospitals, conventional system, everywhere a homeopathy is assisting the, you know, and the
We feel that it is no less time left, no less time left that is coming up.
yes, yes,
I mean, I think next 5 to 10 years, there is no foundation that will come up, and integrative management अभी से ही use होने लगी है, and it will be flourishing only in next
because one
5 to
of
10
our
years.
policy.
अपने आप.
Yes, yes. So that's a
Yes.
great, thing which you said. Yeah, we are working for that. We as a Homeopathic National Council, or the Wiki Council, we are working for that policies that we see that in every hospital there will be some homeopaths also integrating with the conventional system, working a lot together for the different diseases, also in especially in the emergency medical conditions, in the emergency ward we see homeopathy being prescribed. That's our motto. Thank you so much, Dr. Yashika, for here and providing the knowledge, and hope all the young homeopaths and all the doctors who are watching us get some good idea about things going on in homeopathy and
And
will
I
work
hope
and
that it
contribute.
goes viral very soon.
Yes,
I just
sure.
hope that it goes on viral very soon.
Yes, sure, sure. We'll try to make some clips out of this and put up in the Instagram and other platforms.
Yeah.
Thank you so much for being here, Dr. Yashika,
Thank you
and
so
wish
much.
you
It
all
was
the
great.
best. Wish you all the best for all the great
Thank
contribution
you.
you are doing towards research and in your field. Wish you
Thank you so
best.
much, ma'am. Thank you.
Bye.
It was
Thank you
great
so
to be
much.
here. I loved it, enjoyed it. Thank you.
Thank you. Good night.